Today, I am so excited to sit down with Dr. Paige, an osteopathic physician and women's health expert who has become a trusted voice in the hormone and metabolic health space. She's the founder of a thriving direct care practice and an educator who helps women move from exhaustion and confusion to clarity and confidence in their own bodies. You've probably seen peptides and drug company or drugs like semaglutide all over your social media feed. People are stacking vials, passing around pens, promising effortless weight loss. It looks sexy, it looks easy, and it can also be really dangerous when you're buying these things online, guessing at doses, and never actually talking to a doctor who knows your history. In this conversation, we're doing a deep dive into peptides with guardrails. We're going to talk about what peptides actually are without the hype, the truth about microdosing GLP-1, why the reason you're reaching for those tools matter, and what needs to be in place first before you even think about ordering a vial. And because so many of you have asked, we're also going to get into what all this means for women with a history of breast cancer using a simple green, yellow, and red framework. So if you've ever thought, should I be on a peptide? Am I missing out? This is the episode you listen to before you put anything into your body. I'm so happy you're here, Dr. Page.
It's good to be back. I love chatting with you and your crew.
Yay. Yay. Okay, cool. So let's just start. Like, let's set the stage for women who keep hearing peptides. Not every, I think most women know what it is now, but maybe not everybody. Can you just kind of like go over the ins and outs? Like, how do you explain peptides in simple, non hype language?
Yeah, it is interesting because when you hear peptides, it does sound kind of jazzy, right? And to physicians, it's probably like, it's kind of boring. I don't know. Because peptides is such a generic term that it's simply a term that we use to reflect a molecule that is a short chain of amino acids, which are those building blocks that make up proteins. And so it's a very kind of broad category, right? Our proteins, these types of proteins have signaling capacity. So a lot more people are familiar with the term with hormones, right? The term hormones. So a lot of people actually consider peptides as like mini hormones.
Hmm.
And they are similar to hormones in that they act as signaling molecules. So they are simply a molecule that carries messages to in different avenues of the body to different types of cells.
Okay, like that's what it is. And there is, I think, like what you said and what we talked about, like the hype behind it, the FOMO. Like everybody's doing it and you're hearing all these things that it does for you. So it's kind of crazy. So
Yeah.
in your practice, how do peptides fit into your overall approach to women's health and hormones? Are they like central tools or are they more of a cherry on the top, once foundations are in place? Like when do you utilize them?
Yeah, good question. And the short answer is definitely more in the cherry on the top category. But at the same time, I never want to give the impression to women that you have to earn your peptide. So some women have the impression that like, oh, I need to be doing everything else and I have to have all my lifestyle tuned up before I get help from a peptide. And so neither end of the spectrum is true. Right. So when we think about using peptides, it's always in combination with our foundations.
Hmm. Yeah. Okay, good. And so when women come to you asking about peptides, what are they usually hoping to fix? Is it like weight, inflammation, energy, perimenopause symptoms, something else? Like, what do they want to fix?
That is exactly the most important question. Okay, we've heard about these peptides. We know our friend down the street is stacking XYZ, but what is your specific goal? And then I always like to know, in addition to that goal, what is what I call your healthcare philosophy? Like, some women feel like, hey, I want to handle things the most natural way possible. Some women feel like, health by biotech company, they want to do all the things. And so when I know that, we'll kind of know the overall recipe that we want to put together. And that's so important when it comes to peptides because there is absolutely kind of this spectrum of some that are very well studied, very well regulated, then some that are less so. And so When we start with the goal, what I hear the most is related to energy and body composition. I mean, that's
Hmm.
honestly what it boils down to. And I tend to treat women mostly in the perimenopause, menopause transition time. I love
Hmm.
treating women very early in the perimenopause transition because when we recognize those hormone changes early, we can walk together and kind of know the different steps that are going to help them during that time. It's a transformative time, right? It's a huge physiologic adaptation for the body. And so a lot of times peptides can be a safe option to support the body, which in an otherwise extremely physiologically stressful time.
Okay. Yep. Love it. Love it. Love it. Yep. I mean, I know, and we'll dive into it. We're going to dive into the peptides. We're going to dive into ones she would recommend and maybe ones to stay away from and how to go about it and what you need to watch out for. We're going to dive into it all. But I mean, I remember I heard about peptides, I want to say like maybe 3 years ago. And I didn't do anything about it for about a year. But with having breast cancer, my biggest fear is lacking estrogen. It's always because I don't have weight to lose, but thinking about my brain, thinking about my cardiovascular, thinking about my bone health, like the fear of lack of estrogen
Yeah.
and like, how can I support these areas? And there's so many ways we can support without a peptide too in our brain, in our cardiovascular, in our bones. Like there are things you can do. It's not necessarily only peptides, but I was impressed by the emerging research with microdosing and GLP-1. And so that was something that, I've been doing. And so just being transparent, I do microdose of GLP-1 with Dr. Paige as my doctor. She is my doctor. We have run tests and whatnot. So what do you think of it for that?
Yeah. I love that spot. So when you talk about, having a breast cancer diagnosis, estrogen being lower, it's obviously very analogous to a menopause or even perimenopause situation, right? Like low estrogen or chaotic estrogen. And the reality is estrogen is a very resilience building hormone. And so when you take away that block of resilience, it doesn't mean that your health is automatically going to suffer, but it does mean that you have to maybe try different support mechanisms or you have to double down, right? Like you teach this all the time. Like it's extra important for you to meet your fitness goals. It's extra important to pay attention to your nutrition. There's less wiggle room, so to speak. And so when it comes to a GLP-1, because GLP-1s, I've been prescribing them for 2 decades. They were first, studied and used broadly in the diabetes space. And just like a lot of things in our traditional healthcare system, we are very good at recognizing and studying a kind of more severe or advanced pathology, right? But the reality is that our physiology isn't optimal, completely normal, and then overnight we're diabetic, right? So there's this huge spectrum that on one end is diabetes, and on the other end is fairly mild insulin resistance or some miscues in that insulin signaling pathway. So, everything we eat gets broken down into glucose molecules. That's our energy, right? So we talk a lot about, diabetes and insulin and glucose related to diabetes. Really, we should be talking more about energy. That's what we all want. We want the emotional, cognitive, and physical energy to enjoy our life. So that signaling pathway of glucose molecules having to pair up with insulin to get our energy inside the cell in a stressful state can get a little clunky. And
Yeah.
without estrogen can get a little clunky, right? And so that's where a GLP-1 comes in. And part of its mechanism, there's multiple mechanisms when it comes to a GLP-1. But the one that I think is coolest is the way that it regulates insulin and the way thus it regulates our glucose. And insulin, for all the beautiful things that it does, it is a growth signaler and
Mm.
it is a storage signaler. And so, from a breast cancer perspective, there's some really cool data out there related to GLP-1s lowering insulin If I'm lowering a growth signal in the body, what does that do for someone with cancer? It has potential hugely beneficial effects. And if I am decreasing that storage signal, I'm more likely for someone who has excess fat on their body, whether subcutaneous fat or the visceral fat that tends to tuck in between the organs or within our organs. If we can decrease that signal of storage, then obviously the downstream effects of that are huge, related to inflammation, growth signals, all the things that we want to happen.
Yeah, and I mean, even like that is amazing. Like that is amazing. You hear so much about your insulin and monitoring that, but I also think like the cardiovascular is pretty amazing too, and what it can do for our brain health, all the emerging research. With that being said, I mean, so there's a lot of promising things. I really think there is a scary side to all of this. I think, the online buying, I think you already brought up the
Mhm.
stacking and the DIY. Like, what worries you most about women buying peptides or GLP-1 drugs online through a quick click telehealth company or some online company or TikTok? Like, it is wild. And I feel like the other thing people are saying is like, how can I get it at like a really reasonable cost? And I'm like, oh, you don't want to go
Yeah.
cheap on this. We're injecting this into our bodies.
Yeah, I mean, when you say what worries me most, can't pick just one. Right,
Yeah.
that it is hard because it is a complex conversation. Let's just start with what you mentioned about injecting into our bodies, right? Like, it is not lost on me. I say this all the time to patients when it comes to like our nutrition habits. Like when you think about it, nutrition, like we are literally taking foreign objects of the world and ingesting them inside our body. Like that's a huge trust process. And obviously, we should be paying huge attention to that. But that process is a very natural process. Our gut is designed to figure that out. It is designed to have a huge barrier to keep the bad stuff out, get the good stuff in. Anything that slips through, our beautiful detox systems, liver and kidneys are made to process all of that, right? So when you bypass the gut and inject something directly into your body, you're losing all of those natural defense systems when it comes to kind of sorting that out, keep the bad stuff out and just the bad, or, let the good stuff in. And so, of course, the body does have other detox mechanisms, but that right there should make people like perk up their ears, right? Like, I'm injecting this. That is so huge.
I literally just saw that. I think it was today, there was a reel, somebody talking about that. I'm like, "Oh my gosh, like, that's the truth." And
Yeah.
then you're just buying it online and I feel like our bodies work so differently, and especially in somebody who's been through a cancer diagnosis,
So,
this is where you have to be so careful.
yeah. So, when you've been through a cancer diagnosis, there are just multiple things to think about, right? Not only do you have kind of a different physiology concern, right? You have this huge challenge for the immune system to keep cancer at bay, clear any rogue cancer cells. And so the immune system function is like one side of thing that's huge, right? And then you also have just so many pathways, proliferation pathways that make cells grow, angiogenesis pathways that create more blood vessels. And some of these peptides, that's exactly where their magic lies. But when with someone certainly with an active cancer or even a cancer in remission, that's no longer magic. We are not trying to grow. We're not trying to activate those angiogenesis pathways. So that's one of the reasons why someone with a history of a cancer diagnosis has to be extra careful. And then, of course, there's so many unknowns. In theory, someone without a cancer diagnosis who's on no medications, they may have a very like high risk tolerance, right? They're like, hey, let me try this. But if you're on an AI, if you're on multiple medications, you have to know that you're not taking someone that's or something that's going to interfere with those medications. And so just those unknowns alone of is this signaling going to be activating something that's pro cancer growth? And is this signaling going to be inactivating or interfering with some of my other medication burden? Like, those are two huge concerns when you
So
diagnose.
true.
Yeah.
So true. Even like, I mean, I had brought up stacking and to like, I'm just going to say, if you've been through breast cancer or cancer, stacking shouldn't even be in our vocabulary. I mean, there are some people who stack and maybe they're super healthy and maybe they've had blood work but be so careful with that. I want you to break down the difference between because we hear so much about FDA approved medications, legitimate compounding products or compounded products, and the totally gray market where there's vials people are ordering from random websites or Instagram ads.
Yeah. So FDA approved, it is complex. And it's not only complex on a national level, the Food and Drug Administration is a natural or a national body, but then there are also different state regulations too. But FDA approved peptides, GLP-1s are the biggest example of that. So Ozempic, Wegovy, Mounjaro, Zepbound, those are all FDA approved brand name medications that have been through all the rigorous testing. And there aren't a lot of other peptides that really fall in that category. Interestingly, one that is very applicable to the postmenopausal and breast cancer survivor world is one called Vyleesi. Have you heard of that?
I
Yeah.
have. What is that again?
Yeah, so it's actually a peptide and it's kind of cool because it's specifically targeted at libido. And so women,
That's where how that is how I just did a deep dive in my cancer community on intimacy after cancer. And okay. But
so
it's a peptide too?
it's a peptide. But it's FDA approved. It's honestly not available to my knowledge through compounding pharmacies, but never say never.
Right.
But FDA approved, available in your local drugstore by prescription, potentially covered by insurance. And then there's a big gray zone where compounding pharmacies that are FDA regulated. So there is some oversight there. They are inspected and they have, regulations, can produce generic versions that they can't call FDA approved, but are produced by qualified, you'll hear the terms, or I'm sorry, 503A or 5.
Yeah.
So those are legally peptides that are legally being made in FDA regulated pharmacies, even if the peptides themselves aren't FDA approved. And so that's a gray zone that personally, when I talk to my patients and I know that I've vetted a particular, literally just one or two pharmacies, because there's a gazillion of them,
Mhm.
I have a lot of comfort with that. Compounding pharmacies have been filling a gap in healthcare for decades when patients need very specific things. Like when I was pregnant or getting pregnant, I went through the IVF process. I had to get some medicines from the FDA pharmacy because there was no other way to get them. So they've been filling a gap for a long time. I think that's very trustworthy. Where you get into a gray zone, though, is nowadays, telehealth companies to get to that compounding pharmacy is very easy, right? You
Mhm.
can fill out a questionnaire online. You never really talk with the doctor. In my opinion, you never really have informed consent. Informed consent is like doctoring 101. It is my responsibility to make sure my patients know the pros and the cons of medications or procedures or whatever the case may be. And if you're just filling out a questionnaire online and you're excited, you think it's the best thing for you because you've heard so many great things, let's be honest, you're going to fill out whatever it takes to get that.
Totally.
And so, in my opinion, like obtaining a GLP-1 or any peptide through any other mechanism than having a conversation with a physician that you know and trust, and who, more importantly, knows and trusts and knows your story, is irresponsible. And then another tier is these, what falls under the category of research chemicals. So in the research process, certain pharmacies can be approved to create things that truly are not held to the same standard as a FDA approved peptide or an FDA approved compounding pharmacy. And that's where it's getting real wild out there. Like,
Yeah.
completely unregulated, really questionable quality oversight, no prescription required, significant risk of contamination. You sometimes are getting shipped these powders that you're mixing at home without adequate instructions. And it amazes me how much faith people are putting in that process. That is no different than buying them on a street corner. Like, that is,
No, I've heard people ending up in the hospital and having so many situations with this. The one thing I will say that I feel like I hear the most is I am struggling. I've talked with my doctor. My doctor does not work with the compounding pharmacy. I cannot get it from my doctor. What do I do? My advice to them is go to Dr. Paige or find a functional doctor. Unfortunately, is it true that your primary care physician, your PCP, does not prescribe or microdose? Is that correct?
yeah, I think that's going to be true by and large. Like, unfortunately, um, one, there's just a whole maybe generation of people that really don't know the value of having a trusting longitudinal relationship with the physician. You know, they grew up kind of like going to the minute clinic on the corner or stopping by the urgent care, or when they go to their medical practice, that was a practice of like 10 doctors and they'd see someone different all the time. So,
Yeah.
you know, that is one thing. I think people just really aren't accustomed to that relationship, which
Mhm.
honestly, there's nothing that makes me like sadder, because I feel like the relationship between a physician and patient is so sacred and there's healing value to that. I mean, I don't know, sometimes I say like I know people that have more healing relationships with their hairdresser than they do their doctor, because,
Oh my gosh.
well,
It's the truth. It is so the truth.
yeah. So I say all that to say, like, if you do not see the value in a physician as like truly establishing that relationship, I would consider rethinking that. And, you know, it can take extra effort to find a doctor that probably is outside of a big old hospital system, maybe has a smaller practice, because physicians that work for hospital systems, you know, there's just an added layer of control or regulation, right? So not only is the doctor concerned with insurance practices, but they're also concerned with the practices that their employer allows them to do. And that employer isn't going to be concerned, meaning the healthcare system, right? The physician's employer isn't going to be concerned with if you have a specific unique medical need that requires stepping a little bit outside the box. They're going to be concerned with having a very conservative, like low risk situation, right? And so a lot of these decisions related to hormones, related to peptides, I consider them in this way. You hear people talk a lot about evidence-based medicine. Well, yes, we want to have evidence, obviously. But having a population study related to certain things does not tell me what you, the individual, needs. It tells me what happened to a group of people. So I need to be able to talk to you, know the evidence in the population, but know your physiology, and then know also my clinical experience, how I extrapolate my clinical experience and scientific data to meet your needs. And that might sound like, well, duh, of course, but a lot of physicians out there are practicing in the name of science, in the name of evidence-based medicine. Like, if I don't have a study that exactly fits you, I'm not doing it. Well, I think that's a huge disservice to my knowledge, to my clinical experience. And honestly, that's how women are dying because of that mentality. Because,
See.
we won't get into the whole like women's health initiative and
Right.
erroneous views on hormones, but there is a gap in female representation in research. And because of that gap, like we won't have the studies that our male friends have to absolutely prove to the certain level of evidence that some physicians want to require for decades. And it's like,
It's wild.
it will benefit our daughters and granddaughters, but it won't benefit us. And so in the meantime, I'm going to use my knowledge, my clinical expertise, and the data that we have to inform my decision. So
Okay,
that's really,
so people need to either just research a different doctor
yeah. So research a different
or a
doctor,
functional doctor.
find a doctor that honors evidence-based medicine, but also is willing to, has either embraces an integrative approach, a functional medicine approach, so that honestly, I think we have to have the best of both worlds, right? We have to
Yeah, I
stop
agree.
like, oh, traditional medicine is horrible, or oh, functional medicine is such quackery. Like, we need both.
I agree 100%. I couldn't get through this diagnosis without both. Like I am
Yeah.
absolutely all in on that. So let's say somebody comes in and it's a new patient for you and they want to do get on a GLP-1. What kind of is there like blood work that you would test for before you consider this? Like what do you consider or what are non-negotiables before starting any peptide?
Yeah, good question. So I really view me getting to know the patient as this beautiful combination of like self reflection of the patient and professional evaluation, right? And so in that self reflection, we need to know. All about your medical history, about your lifestyle, sleep, nutrition, fitness, stress levels, supplementation, medication history, family history, all of that stuff. And then we get a current assessment of what's going on. And that the cornerstone of assessment of what's going on for sure is blood work. And I typically start with what I call expanded foundational blood work because what some, on the more traditional side would call foundational blood work means, hey, let's do a spot check of your cholesterol and blood sugar. If
Yeah.
anybody who's gone to like their employer based health screening, it's like all they want to know is like my weight, my height, my blood pressure, and two biomarkers. And it's like we know, as especially in females during perimenopause or after menopause, there's a lot more to look at. But then on the other side, I do see some women coming to me with a lot of data. They know all about their minerals, they know all about their co-infections, they know all about their toxin load, and they don't know their thyroid, or they don't know their ferritin level, or they don't know what their blood counts are. You know what I mean? So there's a lot of opportunity, especially with direct to consumer testing, to go really, really deep. And that is irresponsible. I don't know if I've ever told you my famous bowling ball analogy.
No.
So I see all these pillars of health as kind of like bowling pins. And all of those things at any given time, my job is to assess all the bowling pins and know where they stand. And I don't have to worry about all the bowling pins. I only honestly have to worry about the front two, three, four, because if we hit those, what do? We get a strike. You know what I mean?
Yeah.
Because
Yes.
the body, we have to really have so much respect for the body's ability to heal, right? Like if we remove roadblocks to healing, give the body back any components that it needs to healing, it will take care of the rest. And so for a long time, hormones, for example, in our 20s and our 30s, like spot checking hormone levels, that's back bowling pins. Like we don't have a need to do that because if we're checking our thyroid and our blood counts and our insulin and glucose and foundational markers and working with our lifestyle, or hormones naturally regulate oftentimes. During perimenopause and menopause, what do hormones do? They just inch their way right up to the front. Like they're like, I'm the star of your physiology now. Deal with me, right? So anyway, when we think about that expanded foundational testing, we want to know blood counts. There's a smart little panel that gives us kidney function, liver function, electrolytes, blood sugar. I typically want to go deeper into glucose regulation. And in addition to a spot check of blood sugar, we want a test called your hemoglobin A1C. It's a smart little test that gives us the average of what your blood sugar has been running over the past 3 months. We also do a spot check of insulin because we want to get to that. Typically, an insulin level will go up and show insulin resistance long before you'll see it in your glucose. We want to look at markers of inflammation. We want to know about thyroid function. We want to know basic nutritional markers, vitamin D, magnesium, sometimes iron, ferritin. But again, like we could test for a million vitamins and minerals, but we have to focus on like what's clinically meaningful first and then get into the weeds if we need to. What else? We check immune function through blood counts, cardiovascular risk through your lipid panels. And there's a test called ApoB and a test called LP little a that are really important markers of cardiovascular risk that can help us dive deeper than just a traditional lipid panel. And then depending on where you're at hormonally, estrogen, testosterone, progesterone, we may or may not need to test those. I think that's it.
That's amazing. Okay, have you ever had a patient walk in that they're like, "Oh my gosh, I need to be on a peptide," but once you focused on like the foundations and the labs, you're like, her issues improved, and you're like, "You don't actually need a peptide."
Yeah, I think honestly, that's like the coolest thing, right? I
Yes.
mean, naturally, we are humans. We like a good dopamine hit. We like to know the latest and the greatest. And so, we all can succumb to kind of that mentality, right? Of like, ooh, I don't want to miss out. Somebody else is doing peptide. I want to do a peptide, you know?
Yeah.
And I feel that way about peptides and even about like I've trained deeply in functional medicine and there's a lot of fancy testing that I can do, but I have found over the years that when we focus on foundations and correct what I call a lot of littles, it's funny when we talk about, you've heard the term like we want root cause medicine. We want to get to
Yes.
the root cause. Well, I kind of giggle when I hear that because I'm like, as though there's one, like, oh, there's one magic thing that we're looking for in the body as the root. And when we wipe that out, we're going to be done. Like, that's our human brain wanting to see things in black and white. But in reality, our health is very much a recipe. We want to get all the contributors on the table. And what I find is a lot of littles. Like, we tweak this, 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 and this, and this, and that gets the ball moving in the right direction. So, like you said, at the end of the day, we don't necessarily need to go deep in the peptide conversation, especially around, quite honestly, what I would consider the only green light peptide, which is a GLP
Yeah. Is this for breast cancer specific
or
or
period.
anybody?
Yeah.
Okay, interesting. Okay, because that's where I was going next is the peptides green, yellow, and red. So you were saying the only one that you say is like it's typically a go unless we determine it's not, but it's typically a go is only a GLP-1.
Yeah, the only systemic one, and there's a little bit of caveat, but related to the GLP-1s, one from a safety perspective, a sourcing perspective, but also to your earlier point, just because they are so magical. Like they can do so much. They can support you so well, especially when you're using them responsibly and dealing with nervous system issues and sleep and nutrition and fitness, not with the mind of perfection, but being on that path, there's not a lot else that we need frequently. And I say the only systemic one because you may have heard of another one called GHK copper that a lot of people use topically as an anti-inflammatory. It's kind of like a beauty thing, a hair growth thing. And that one's pretty safe, probably just by nature of like low systemic absorption as well. So a lot of people ask about that one. It's kind of like in that it does have some theoretic mechanisms that I wouldn't think systemically, we would want to use it, but in its topical form, I would consider fairly green light for those after a diagnosis, maybe not. And I honestly quite transparently like no peptide except a GLP-1 would I recommend experimenting with an active cancer, right?
Right.
Just because like your focus is in a different area. You have more
Yeah.
of a singular focus. But yeah.
What about like I feel like the one that I hear everywhere is
Yeah. So when we think about like what are we looking to do with these peptides? There's kind of like some general themes of like what they do. So they're signalers. Their responsibility is having a particular signal, and that can land in multiple areas of the body. And so BPC 157, like part of its signaling benefit, which there has been some benefit shown related to gut health and ligament, tendon recovery, musculoskeletal health. But a lot of that mechanism is proposed to be like increased angiogenesis. So
Mhm.
increased blood cells, which you can imagine to an injury, we want to get those resources where they want to go. And that's, it has anti-inflammatory effects in that way. But when it comes to a cancer situation, potentially part of what cancer cells use to spread themselves is this creating new blood vessel pathway. So that risk is there.
I mean, and the thing is I've looked into that too, and I just saw some research on it. I mean, there's like no human studies on it. It like the
There's like a
studies
study
that
of like 17 people.
yes, that's it. That's it. Like that's I think back to like and I mean not to compare, but I think back to the COVID vaccine where all of a sudden the COVID vaccine came out and half the population was like, "Yes." And the other half was like, "Heck no, I'm not putting that into my body." And then it's so funny because the majority of the world is now putting peptides in their body without human studies.
Truthfully. Yeah, and
You know what I mean?
one of my superpowers, which is absolutely a curse, is like I am so big picture and I am a sucker for like alignment. Like
Yeah.
you're using the same logic. I want to see that you're applying that equal opportunity, right? Like you're in alignment. And so when you hear things, you're like, oh, wait a minute. You said this over here, but then you're twisting that logic to fit this. I'm like, oh, I'm out. I can't
Yeah.
do that. So,
Interesting. Okay, one other question about that. There's other peptide companies or maybe they offer one that is not a injection. It's like a I don't know, a
yeah.
pill, whatever it is.
Well, uh-huh.
Does that work? Can it work?
Yeah, that's a good question. So, interestingly, specific to BPC 157, the oral formulation does tend to work decently related to the musculoskeletal benefits, but much, much less than injection. But I think the reason the oral formulation of BPC 157 so strongly is that it does have gut health benefits in
Mm,
its animal studies. And so people with inflammatory bowel disease, chronic gastritis, ulcers, like there's a potential benefit there, which kind of makes sense, right? Like you're ingesting it orally, delivering it almost like superficially to the lining of your gastrointestinal tract. So that's probably why, obviously it works better for GI issues. But like, and the evidence is like promising, so
okay, good.
that is one that I have to say, I have recommended in some people who don't have a cancer history, who are all up to date with their screenings, who are metabolically optimized and low risk. And we've done functional medicine gut testing, and they're having really, really stubborn gastrointestinal issues like inflammatory bowel. And you could see how like that risk benefit ratio as you get, I don't want to say to like the end of the line, right? But like you're trying all these things and you're like, I don't see the downsides. Maybe there's a vacuum, an empty spot really that I would love to have more data that it's not there, but I seem to be low risk and I have a lot to gain, so it seems like I have less to lose and more to gain. That's what would, prompt someone to maybe step outside.
The
Or
injectables.
yeah, like, and just increase their risk tolerance to say like, yeah, I'm going to try this.
But again, I hopefully you all heard is there was tests before that and really discovering this person's body. So if you could give a woman who's listening and she's been trying to get a peptide and she maybe wants a simple checklist to walk through before starting any peptide or GLP-1, what would that be? Like a
Kind of simple checklist type stuff is really that, one-on-one conversation with your doctor, full review of your history, that expanded foundational blood work, and then exploring the pros and the cons of other mechanisms with a real honest, like, thought process, right?
yeah.
So I say that because I talk with a lot of people, and not to impose my, um, like, my process on other people, right? But when a lot of times people come to me and they're like, oh, I would never do this, like this prescription medication. But I want to do this. And so it's my job to really ask why, and 9.9 times out of 10, the I would never do this, like a certain FDA approved prescription medication, is based on lack of data, fear, and when we discuss the true evidence, that is the winner, the more traditional medication over something that they didn't have fear around because they didn't have the data to know the cons. They had faith and excitement around it because their neighbor had a wonderful success story. And so it's like really everything resolves with information to say, okay, I know your personal experience is that you've heard that, you have 5 girlfriends and they all hate their IUD, for example, but it's like, I have a lot of women that love their IUD. You can fill in the blank with a lot of other interventions there.
But yeah, there's so many things that work for one and don't work for another. I can tell you, and I can, with Dr. Page, we worked together before I went on my GLP-1. There was blood testing before. There's blood testing after 6 months to see. There's, just staying on top of it. In fact, we're just about to order some more blood work now. So really quick, if somebody wanted to work with you, can they do that? Like, don't you offer something where it's a community where they could be part of? And then
Yeah.
can you talk about that for a second?
So I founded what I call my medical sisterhood called GOSA Wellness. And we treat women who are going through perimenopause and menopause. And I call it a sisterhood now and not even a medical practice because I just feel so strongly that, like, women heal in community. And so rather than just providing one-on-one, one-off consultations, we partner in community either over a 90-day period or an ongoing membership. And then alongside your care with a clinician, we have an online community where we have resources and coaching calls and events, and really just try to gather that community so women can know they're not alone, which is half the battle, right? We all secretly feel like, oh my gosh, am I the only one going through this? And it's just amazing when you get women together, like magic happens.
It's true. I have that in my cancer community. It is
Yeah.
really, really the truth. I can't imagine like just women in general, like going through this, navigating this on your own. Like it's not easy. I'm really happy. Did we miss anything? Like this conversation, I think is such an important one because it makes me so, so, so nervous. I feel like we're in the wild, wild west when it comes to peptides and what I see online. And I'm like, gosh, we have to be more careful. We have to be more mindful. I mean, and just making sure you're working with a doctor who knows your body, knows if this is the right thing for you. So you have an understanding when you do get maybe something in the mail, a vial, you know what you're doing. You know how to, I mean, it is literally crazy what I see.
Yeah.
And it makes me so nervous. And so I just wanted to share this. I really wanted you just to go slow, work with a doctor. You're not missing out. Get to the basics of your health. There's doesn't necessarily need to take a peptide. Yes, with a GLP-1, there can be some promising stuff, emerging research, but you have to do it cautiously and you have to do it along a doctor. And that's my opinion.
Yeah. Same. I mean, I get that it's frustrating out there, and, there are a lot of roadblocks and limitations to finding a clinician that you trust. But this is your health, right? Like, we shouldn't be letting an insurance company tell us what we need to do to make us healthy. We shouldn't be, feeling like I feel like we should be spending our money in alignment with our values. And if we value health, then guaranteed I'm going to have a line item in my budget that I'm dedicating towards my health, right? And
100%.
yeah, and so I would just encourage people to, really just take survey of like, what is my goal? What am I, willing to do to meet that goal? What is my preferred approach? And really look for that physician that's going to sit with you, know your goals, know your healthcare philosophy, and practice kind of this shared decision making of creating a plan together. As opposed to, what I hear oftentimes is like, oh, they said I'm not allowed to do that, or that that's not for me. And it's like, no, this is a conversation. You're a grown ass woman. Nobody needs to like, you don't need to be asking permission to do something. It's a partnership.
Yeah, and getting second and third opinions. You are in the driver's seat of your health. And I always say this in the cancer world too. If you go to your breast surgeon or oncologist and you're like second guessing it, they're they don't run the show, you do. And if they were in your shoes, they would get opinions too. So go meet with people,
Yeah.
search around, ask in your community. I'm going to of course have Dr. Page's info below in the show notes so you can reach out to her, check out what she has and what she can offer you, but I just think like we just need to be really careful. So I can't thank you enough for being here.
It's always my pleasure.
All right, you guys, make sure to check everything in the show notes below. I'll have everything in there that we discussed, Dr. Page's info, and we will see you all soon.